Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to cover the McKenzie Protocol, the basic motions for low back pain. You may see this written as the Mechanical Diagnosis and Therapy, often abbreviated to MDT. But throughout this video, when I speak about it, I'm just going to use the term the McKenzie Protocol. Again, I'm going to go over the basic exercises for low back pain. The McKenzie Protocol for low back pain is used for an intervertebral disc injury. This could be a disc bulge or a disc herniation. The intervertebral disc is located between each of the individual vertebrae in the spine, except for the first cervical vertebrae and the skull, and the first and second cervical vertebrae. But in the low back, first of all, the low back is named the lumbar spine in medical terminology. In the low back, there's an intervertebral disc between each of the vertebrae. There are several parts to the intervertebral disc. There is the inner part, which is called the nucleus pulposus. The outer part is called the annular fibrosus. If you think of the intervertebral disc as a jelly donut, the inside part, the jelly, is the nucleus pulposus. You may see this written as NP. The objective of the McKenzie Protocol exercises is to move the nucleus pulposus forward away from the spinal cord so that it is not placing pressure on the spinal cord. When we speak about the McKenzie Protocol, the objective is what's called centralization. Oftentimes, when there is pressure on the spinal cord or pressure on one of the spinal nerve roots that branch off the spinal cord in between each of the individual vertebrae, and this pressure is put on by the intervertebral disc, there can be symptoms down the entire leg. These symptoms are radicular symptoms because they are radiating pain caused from impingement on the nerve. These symptoms can be sharp-shooting shock-like pain, burning, stinging pain, numbness, tingling, and just overall lack of sensation in that area. So the objective of the McKenzie Protocol is what is called centralization. That means that we are trying to lessen the symptoms in the leg and bring those symptoms closer to the source, which is in the lumbar spine, the intervertebral disc in the lumbar spine. These symptoms are being centralized because the nucleus pulposus is being moved forward away from the spinal cord and away from the spinal nerves. All these exercises are moving into extension, which is bending backwards. If you have a condition where extension increases the symptoms, then you do not want to do these exercises. If bending backwards increases the pain in the lumbar spine, in the pelvis, or anywhere down the leg, you do not want to do these exercises. But if the symptoms are lessened when you are bending backwards, then these are the ideal exercises for you. The first exercise in the McKenzie Protocol for low back pain is simply to be laying in a prone position. If you have a chiropractic table or a massage table or any type of table that has the face hole, put your face straight down. If you do not, then alternate. You turn your head to the right side the first time you do it, and then to the left side the second time you do it. Just alternate back and forth. All you're doing is you have your arms down by your side. If it's more comfortable for you, you could have your arms out to the side, but either way, whatever works best for you, and you want to lay in the prone position. If this centralizes your symptoms, meaning that it lessens the pain in the leg and brings the pain or symptoms closer to the spine, then you hold this position for 30 seconds. Once 30 seconds is up, you can relax, and you could perform that for 10 times a day. Now the second position is, instead of being in a prone position where you're laying face down on the table is you have your forearms on the table and you are bending the back backwards like this, moving into extension with the lumbar spine. Again, the lumbar spine is the medical terminology for the low back. If this position centralizes the symptoms, hold this position for 30 seconds. Once that 30 seconds is up, you can return to the prone position and hold this position for 30 seconds. And then back to the second position where you are on your forearms and the lumbar spine is extended. Again, hold this position for 30 seconds if it is centralizing your symptoms. And then go back to the prone position. Now the third position is having the palms on the table. And obviously you're going to be extending the lumbar spine farther. If this position centralizes your symptoms, hold this position for 30 seconds and then return to the prone position. And you can repeat that for 10 times throughout the day. Again, we are looking to centralize the symptoms, meaning that we are looking to bring the symptoms closer to the source of the pain, which is the intervertebral disc on the spine. And this position is going to help to move the nucleus propulsus forward away from the spinal cord. So you could hold this position for 30 seconds and then relax and go back to the prone position. So again, position number 1 is the prone position. Position number 2 is on the forearms. And position number 3, what is known as the prone press up, is when the palms are on the table and the lumbar spine is in a greater amount of extension. And each of these positions can be held for 30 seconds each time that you perform it, and you could perform it 10 times throughout the day. Now, all of these exercises, the key is that they need to be centralizing your symptoms. If they are increasing your symptoms, you need to stop immediately. You never perform an exercise that increases your symptoms, that intensifies your symptoms, or that elicits symptoms. If an exercise elicits or intensifies symptoms, stop that exercise immediately and find a viable substitute. So again, the 3 positions for the McKenzie Protocol, the basic lumbar exercises are: 1 is the prone position, 2 is on the forearms and the lumbar spine is in extension, and then 3 is on the palms. This is the prone press-up position, and the lumbar spine is in a greater amount of extension. And hold these positions for 30 seconds, and each one can be performed 10 times throughout the day. The McKenzie Protocol is best used for an intervertebral disc injury. It could be a disc bulge or a disc herniation. Start with exercise 1, and then advance to exercise 2, and then advance to exercise 3. If you can only do exercise 1, then stay with that one as long as it is helping to centralize the symptoms, and then advance to number 2 at a very slow, gradual, calculated rate. And then the same thing as you advance to number 3. Thank you, everyone, for watching today's episode of Dr. Ozello's Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Please feel free to visit my website at championshipchiropractic.com, where you can get additional information on my book, and you can also visit my blog. My blog contains articles on spine health, sports medicine, health, and fitness. Please feel free to like this video. Please, if you have any suggestions, questions or feedback, please leave them in the comments section below. You can subscribe to my YouTube page, Dr. Donald A. Ozello, DC. If you are watching this video, then you are on my YouTube page. Again, thank you very much for watching today's episode where I went over the basic McKenzie Protocol exercises for the lumbar spine. Always remember to train hard, train smart, get adequate rest between training sessions and competitions, utilize nutritional and supplementation strategies that work for you, stay injury-free, and accomplish your